Hi, my name is Shakayla and I'll be your nurse today. Can you please state your name and date of birth for me, please?
Jayla Harmon, May 27th, 2008.
Yes, ma'am. Thank you. Today I'll be performing a Heent assessment. During this assessment, I will be assessing your head, your ears, your eyes, nose, mouth, and throat. Is that okay?
Yes, ma'am.
Yes, ma'am. So today, first, I'll start off with the head exam. The head exam, I'll be inspecting your face, making sure that everything is symmetrical, your skull seems to be symmetrical. I'll look on the left and right side of your face. I'll look at right side, left side. Yes, ma'am. I don't see any scars or any acne or anything on your head. Next, I'll be inspecting your head, like the top of your head, your scalp. Seems to have even hair distribution, and your forehead, nothing wrong with that part. Next, I'll be palpating your head. Is that okay?
Yes, ma'am.
Okay, I'll be palpating, feeling for any lumps, bumps, or decompression. Do you feel any tenderness?
No, ma'am.
Yes, ma'am. I have no abnormal findings with that. Next, I'll be palpating your temples. Yes, ma'am. You have a strong pulse that way. Next, I'll be going down to your mandibular joint. Can you open and close your mouth for me? One more time. Okay. I see that you have full range of motion. No popping or clicking noises. Do you have any tenderness with that?
No, ma'am.
Okay. Next, I'll be palpating your frontal, which is the top of your head. Do you have any tenderness with that?
No, ma'am.
Okay, next I'll be going down to your maxillary sinuses. Do you have any tenderness with that?
No, ma'am.
Okay, there was no tenderness reported. Yes, ma'am. Next I'll be doing the cranial assessment. Is that okay?
Yes, ma'am.
So first I will be testing your cranial nerve 1, which is your olfactory, which means I will be giving you a scent to smell. And we'll close off each nostril, one, then the other, to see if you smell the same with both nostrils. Is that okay?
Yes, ma'am.
Okay. So I'll be giving you this car freshie. Can you close off one nostril? Can you smell with that one?
Yes, ma'am.
And then we'll close the other nostril. Can you smell with this one?
Yes, ma'am.
Okay, great. Seems like you can detect the smell with both nostrils. Next, we will be testing cranial nerve 5. Is that okay?
Yes, ma'am.
So next, I will touch the cotton swab to your face on each side, making sure it feels the same on both sides. Is that okay?
Yes, ma'am.
Okay. Does it feel the same on both sides?
Yes, ma'am.
Okay, light touch is felt symmetrically. Next, I will be testing your cranial nerve 6, which is your facial. I will need you to smile for me. Okay, Brent, I need you to make a mad face. Yes, ma'am. Seems like you have symmetrical facial movements bilaterally. Next, I will be assessing your cranial nerve 9, which means I will get this tongue compressor. I will get my otoscope, turn the light on. Can you open your mouth for me? Stick your tongue out. Can you swallow? Great, thank you. Reflex is present and symmetric. Next, I will be putting this back in your mouth, and I need you to say "ah" for me. Is that okay?
Yes, ma'am. Stick your tongue out. Say ah.
Yes, ma'am. Thank you. I see symmetric vocal cord movement. Next, I'll be performing the eye exam. I'll be looking at your face in general, inspecting your eyebrows, your eyelashes. I see no abnormal findings with that. Next, I'll be looking at your lower and upper conjunctiva. I will pull your eyelashes down this way, and I will pull them back up, looking at the upper. Can you look down for me? Okay. I see no abnormal findings. Can you look left and right for me? Yes, ma'am. I see you have a little bit of yellowness to your right eye. It might be a little bit of irritation. And your sclera looks to be agitated on your right eye. So next I'll grab my otoscope and I will assess from one side to the next, looking for any foreign bodies or color differences. Is that okay?
Yes, ma'am.
Can you look over here for me? I see that your left eye is dilating when the light gets closer. Now I'll be looking at your right eye. Yes, ma'am, you have dilation with that right eye too. Your pupils are equally round, and I have no other abnormal findings. I will be now performing the peripheral vision test, which means I'll start with my hands here, and I'll move them out to the side and tell me when you can no longer see my hands. Is that okay?
Yes, ma'am.
Okay, so I'll start right here. We'll start now, okay?
Okay.
So when you can no longer see my hands.
Can't see.
Okay, great. Now I'll be performing your visual fields test. Look at my nose and tell me when you can see my hands, okay? My nose right here. Okay, I'll be bringing them all the way up, okay?
I can see them.
Okay, now I'll be testing your superior peripheral vision, okay?
Yes, ma'am.
Okay, can you see?
Yes, ma'am.
Can you see?
Yes, ma'am.
Great. Next, I will be putting my finger close to your face and I'll be moving it away, okay?
Yes, ma'am.
And I need to use my otoscope with the light to see if they dilate, okay?
Yes, ma'am.
So, look here. Look here. Yes, ma'am. Now I'll touch your 6 cardinal views, okay?
Yes,
Which
ma'am.
means I'll have here, I'll go up, let me use this. Up, down, middle, top, your nose. Great, thank you. Next, I'll be performing your ear exam, okay? I'll be looking at your ears to inspect to make sure they're symmetrical, which they seem to be. I will also be looking at your external canals to make sure there isn't any discharge on both sides, okay?
Yes, ma'am.
Yes, ma'am, I'll check your right ear now. Okay, great. Now I will be using one of these things to put inside your ear to look at your auditory canal. Is that okay? I
Yes,
won't put it
ma'am.
all the way inside, it'll just be the tip, okay?
Yes, ma'am.
Let me know if you feel any tenderness or if anything hurts, okay?
Yes, ma'am.
Alrighty. Okay, and now we'll go to the right ear. Next, I'll be performing the whisper test, okay?
Yes, ma'am.
Basically, I will say a word, and you will tell me what that word was out loud, okay?
Yes, ma'am.
I'll whisper the word in your ear. Can you close that ear for me?
Baseball.
Okay, close this ear for me.
Apple.
Okay, thank you. Okay, next I will be doing your nose exam. I will be inspecting, looking for any deformities. Inspect left and right nostril, okay? Yes, ma'am, I see no abnormal findings. There was a pink color, it was pink colored, there was no discharge, and no other abnormal findings. I will also be looking at your septum to make sure there is no septum deviation, okay? Let me turn this light back on. Can you relax yourself? Tilt your head up. Great, thank you. Next, I will be doing your neck exam. I will be inspecting your neck. Can you look up for me? I'll be inspecting for discoloration, which you have some discoloration to the front of your neck. I'll be looking on this side. I'll look at the back. And I'll look to the right side. Yes, ma'am. I will look at your trachea. Can you lift your head up? Seems to be midline, mid-level. Good. Okay. Next, I'll be making sure there is no masses, lesions, or particulars. Okay. I'll be palpating right here. Let me know if you feel any tenderness. I feel no masses, or you have no tenderness. Okay, thank you. So next I'll be palpating in a circular motion. I will start with the lymph nodes. Is that okay?
Yes, ma'am.
Do you have any tenderness?
No, ma'am.
Okay, there was no tenderness reported. I will start with your preocular, which is behind the ear. Do you have any tenderness there?
No, ma'am.
Okay. Next, I'll be having your post-auricular, which is behind the ear. Okay. Do you have any tenderness there?
No, ma'am.
Okay. Next, I'll be moving to your tonsillar. Do you have any tenderness?
No, ma'am.
No palpable pulses. Now I'll be going to your submandibular, which is here. Are you sure you have no tenderness?
No, ma'am.
What about in your submental, which is your chin?
No, ma'am.
Great. Now I'll be moving down to your supraclavicular. Do you have any tenderness?
No, ma'am.
And then I'll move to your infraclavicular. Do you have any tenderness?
No, ma'am.
I'll move to your left side to test. Do you have any tenderness on your left side?
No, ma'am.
Great. Next, I'll be moving to your occipital, which is behind your neck. Do you have any tenderness?
No, ma'am.
Great. So I found that there were no palpable pulses throughout all of those that I just checked. But other than that, there were no abnormal findings. I will palpate your thyroid. Can you turn this way? Can you turn that way for me? No tenderness?
No, ma'am.
Great. Next, I'll be performing the throat exam. I'll be looking at your lips for any cracking, Let me use my light. I see no cracking or anything. Do you have any tenderness
No,
on
ma'am.
your lips? Okay, great. I will look inside your mouth, underneath your tongue, at your oral mucosa, okay? Alrighty. I will look at your throat. Let me see. Can you stick your tongue out for me? Great. This seems to be a perfect color, perfect pink color. The throat texture shows no abnormal findings. I will be looking at your tonsils now. Is that okay?
Yes, ma'am.
All right. Your tonsils seem to be not enlarged, the same size on bilaterally. Your uvula shows to be midline, and your